Good evening, everybody, and welcome to DCU wherever you are across the world. For some of you, it's the middle of the day. For others, it's 4 in the morning, which again is a very kind of sharp reminder to us about what the Italians call the globalità and the sense of all of us kind of sharing this experience together. And certainly COVID has done that to a world. Of course, at the other side of the coin is that COVID has demonstrated the grave inequalities in the world. And while the cliched line is we're all in this together, as somebody said, we may be in the same boat, but we're in the same sea, but we're in different boats. Tonight is an important event for us, an important opportunity to reflect on the year, but also to look ahead. I'm very sorry that you're not physically with us here in DCU. It's a beautiful evening here on campus. I'm in the oldest part of this campus, the building called after Prince Albert, which was an agricultural college. And it's here that the blight and the Great Famine was identified. And of course, that in itself was a massive crisis for Ireland in the 19th century that had global implications. And of course, the communication of the famine has been problematic ever since. I'm delighted to welcome our moderator tonight, Philip Oucher-Hayes from RTE. You're very welcome, Philip. And Philip will lead the discussion in our very distinguished panel. Indeed, one of the lessons, I suppose, and the benefits of the pandemic has been our familiarity now with the technology and the ability to bring together contributors from across the world. So we're very grateful to the panelists and delighted that you could be with us this evening. Of course, the whole COVID communication thing is so important because communicating public health advice and I suppose scientific knowledge has been critical in the fight against the virus. And communication, science communication has been an important bridge for us between researchers and the public, helping all of us, I suppose, to deepen our scientific understanding, to avoid hazards, to wash our hands, and to navigate risks. And major challenge, of course, which all of you will be aware, and I'm sure the speakers will refer to this, that in some ways COVID was a moving target. And if you begin by our understanding of what is this novel coronavirus and the way in which developed right through, even to today, I suppose, and the Delta virus, the implications of that, and the changing messages from day to day, and the use of social media, for instance, in shooting messengers, as we've seen in our own university today. So today, and this conference offers us a chance to review the achievements, the challenges and the lessons learned in communicating COVID-19. And I think it was that kind of great car maker, Henry Ford, who said the only real mistake is the one from which we learn nothing. Hopefully we've learned from this. As president of the university, these opportunities are always a chance for me to boast about our people, and that's part of the job, and I'm always proud to do that. But we're very proud at DCU of our record in communications, and particular science and health communications. Our School of Communications here at the university is ranked number one in Ireland, and by QS subject rankings, that communication is in the top 150 worldwide. We have centres and programs. I won't delay you for that. But today's MC, Barbara Gormley's PhD research is in pandemic communications, and her own CV, I suppose, reflects some of the depth and the variety that of our strengths and the issues we'll discuss tonight. She's an Irish Research Council scholar, was seconded to Communications and Behavioural Science Committee that advises NPHET on COVID-19 responses. And Barbara is also working on a Science Foundation Ireland funded project on vaccine hesitancy, and she lectures on our MSc in Science and Health Communications here at the university. Very early on, of course, in the pandemic, we established a COVID research hub here at DCU. And I think that what has been striking about COVID is the sense in which the battle against the virus was as much about the social sciences and humanities and communications as it was about hard sciences itself. So we're proud of the achievement, and tonight is part of that. So this gives us a picture of, I suppose, what we try to do here. I'm delighted to welcome our guests. Many thanks to the organisers of this, particularly to Barbara, whose CV I've expanded on already, to Caroline Cullen and to Pádraig Murphy. I hope that you enjoy today's discussion. And now I'm delighted to hand over to my colleague Barbara, who will introduce you to our distinguished panelists. So thank you.
Many thanks to DCU's president for opening our webinar this evening. During COVID-19, science communication emerged as a powerful tool for managing public health responses. Done well, science communication is a bridge between researchers and the public. It promotes scientific understanding and helps people avoid hazards and navigates risk. We know that a vaccine is the ultimate line of a defense in a pandemic, but good communication is also a crucial line of defense. Hopefully, important lessons have been learned over the past 16 months to ensure that stakeholders know how to mount effective science communications and galvanize populations towards positive health outcomes in future crises. For the past 6 years, I've been researching pandemic communication. A key aim of my research is to understand how key stakeholders communicate vital and accurate information to the public. Public health scientists, journalists, and public health communicators play a crucial role. Over the past year, I've been lucky enough to be tracking excellent science communicators, including those represented on our panel tonight. I'm delighted to introduce our 5 speakers who have been to the fore of science communication during COVID-19. So joining us from New York is Jodie Lannard. Jodie formerly worked at the World Health Organization as a senior pandemic influenza communication advisor. She is a risk communication consultant and co-contributor to the Peter M. Salmon Risk Communications website. Also joining us from New York is Meg Tyrrell. Meg is a senior health and science reporter at CNBC. She's reported on multiple public health emergencies, including Ebola, Zika, and COVID-19. Meg also co-hosts the Stat News podcast, To Read Out Loud. From Scotland, we have Müge Chervik. Müge is a physician and clinical lecturer in infectious diseases and medical virology at the University of St. Andrew. During COVID-19, Müge was an advisor to the WHO and the Chief Medical Officer of Scotland, and is a member of a UK Department of Health Expert Committee on Respiratory Virus Threats. From Washington, we are joined by Carol T. Bergstrom. Carol is Professor of Theoretical and Evolutionary Biology at the University of Washington. He's the co-author of the best-selling book on disinformation and misinformation entitled Calling Bullshit, The Art of Skepticism in a Data-Driven World. And finally, from Sydney, we are joined by Gideon Merowitz-Katz. Gideon is an epidemiologist at the University of Wollongong, where he specializes in chronic disease research and communicating uncertainty and public health. Gideon is a frequent scientific contributor to The Guardian and The New York Observer. And it's not yet 5 a.m. in Sydney, so we have to give a special thanks to Gideon for joining us at this hour. I will now hand over to our chair, Philip Boucher-Hayes. Philip is a well-known journalist and broadcaster at RTE Ireland, our public service broadcaster. So over to you, Philip.
Let me unmute myself there and say good evening to everybody, and thank you very much, Barbara, for that generous introduction. Let me also say straight off the bat, if I appear a little bit distracted, it's because I got my second Pfizer vaccine this morning, and it has left me feeling a little bit floored. So I apologize if I don't pick up on absolutely everything that everybody says, but I can assure you my wife says that it is no worse than my least severe case of man flu to date. As a journalist, I'm here, frankly, I said yes to this when Barbara asked me to do it, because we in media, in Irish media, certainly have as much to learn from what went on and how we should be doing things differently in the future. And that, I hope, is what we all managed to extract from the conversation this evening. So I'm going to kick off, I think, with Jodie Lannard, ex of the WHO and now a risk communications consultant. Jodie, let's rewind the clock, if we can, please, to December 2019, January 2020. What worked in our initial response and what didn't work?
Well, first, I would like to give you something for having gotten your vaccine. I don't know if you can see this, but I'm dedicating this button to you, and I'll send it to you in the mail, okay?
Thank you very much.
I actually think a lot of things really did not work. I would like to be able to say People announced the problems early, people involved the public early, people trusted the public with scary information that might happen. But what mostly happened early, in my opinion, around the world was governments telling their publics not to worry. And instead of preparing the public for what might happen or what was already happening, governments, while shaking in their boots and being absolutely petrified in their own agencies, wanted the public's level of concern to be down here, even though their own level of concern is up here. And as I'm sure Barbara knows from her studies of pandemic communication, the goal of official communication is to raise or lower your target audience's level of concern as close as possible to your own level. You don't want it to be higher and you don't want it to be lower, but almost all governments all around the world wanted the public's concern to be low, because they took any sign of concern as panic, which is a typical and very hard to treat symptom of official communication anxiety. And official communication anxiety is a syndrome that causes officials to be petrified of their publics. And I think we saw this certainly in the United States, when long after it was very clear that COVID was spreading, even asymptomatically, as in the case in Bavaria, Germany, we already knew there was asymptomatic spread. The US CDC was telling people that the risk here is low, that the situation was under control. I'm not going to touch Trump because that's a totally different category of problematic communication. But people who should have known better were busy trying to reassure the public instead of teaching the public how to get ready, teaching them about what test and trace might mean, teaching them what non-pharmaceutical interventions might mean, teaching them what a pandemic would be. Instead, they did not want people to even use the word pandemic. Now, I'm even going to give a criticism of Dr. Tedros at WHO, because I think he also was petrified, and I'll try to end with this one note for this question. He was petrified of public emotion, and he had a mantra that went like this: facts, not fear. As if facts and fear, I mean, we have an expression in New York, it's like, is it faster to New York or by bus? It's an illogical question. Facts and fear are not opposites of each other. They live together. If people knew the facts early on about COVID and about what was happening in the pandemic, they would have been more fearful. When they get a better understanding of what they can do about it, then they become a little bit less fearful. Instead, the government wanted the public to have no fear at all, did not want to help them prepare for what might need to happen, did not want the publics to have what Peter Sandman and I call the oh my God moment. And the goal in pre-pandemic communication should have been the teachable moments, to teach people to have their oh my God, look what might be happening moment before it happened.
One of the reasons given at the time, Jody, for not encouraging people to have oh my God moments was that we knew that there was a high chance we were going to be in this for a very, very long haul. And you can't ask people to stay at an elevated state of alert for very long, because they just won't. It won't be long before they stop listening altogether. Have you any sympathy for that?
No. All long emergencies are roller coasters. There's teachable moments here, then there's a teachable moment in India. It's a long haul for the whole world, but it's a series of epidemics around the world, epidemics of emotional information that's scary and epidemics of actual outbreaks. So yes, it's a long haul. I'm not worried about pandemic fatigue. I was a little bit worried at the beginning that everybody in the United States locked down all at once after, I think people overreacted because they were taught to underreact. Now there's so many stories I would like to tell you, but everybody else needs to tell their stories. I'm not as worried about the long haul because the public was not taught at the beginning that it was going to be a long haul. Everyone expected that it was going to rip through and then be over. The public is only now getting used to the idea that this isn't going away soon.
Well, let me ask a question that might elicit one of those stories, please. What were the most effective pieces of pandemic communication to your mind? Best and worst, if you want to.
I'll do a best. Best usually Singapore usually pops right into my mind. New Zealand, of course, the leadership in New Zealand was very open with the public and very empathic with the public's fears, as opposed to trying to squish down the public's fears. Singapore told the public every last detail of what they knew about what was going on. People could follow every new case, every new intensive care unit case. The public in Singapore very quickly learned what outbreak investigation was like, and they could follow it and they could understand it. It was actually beautiful to watch their daily reports on their website. Also, Prime Minister Lee very early on said they didn't know what was going to happen. They didn't know how bad it was going to be. Leaders all over the rest of the world were saying the risk here is low, whereas PM Lee was saying this might get really bad, we don't know yet. So he was helping the public brace themselves for what might be coming.
Singapore's government has a very different relationship with its public to that in most Western liberal democracies, where trust and belief in what government has to say might not, isn't remotely as high as it is in Singapore. Are you making a fair comparison there, or is Singapore perhaps an unrealistic barometer?
Singapore is always an unrealistic barometer in that sense. But what Singapore has done is establish the genuine expectation among its people that they are going to be told the truth, and I'll say most of the time. And the rest of the governments around the world, including my own, and I do not just mean the Trump administration, this goes back many administrations, they want to be trusted, but they don't necessarily act trustworthy. So during this pandemic, I think the publics around the world have come to a more accurate perception of how trustworthy their governments are and how much trust they should give to the government. And that level is lower than the governments would like it to be. I think the public understands better now in many countries that governments are not as trustworthy as they pretend to be. And I mean that in a very harsh way.
So what needs to happen now in the wake of this pandemic in terms of preparedness for the next one?
Well, when I was working at WHO during and after SARS, they asked me and my husband, Peter Sandman, to give them some recommendations for outbreak communication guidelines. We gave them 6. I will tell you only the 6th one we recommended. The recommendation was acknowledge and apologize for errors and mistakes and misimpressions along the way. When the member states of WHO voted on the 6 guidelines that we had proposed, they accepted the first 5. They voted down the guideline that said, acknowledge and apologize for mistakes and errors and misimpressions, which misimpression being another word for lies and cover-ups. So once again, the fact that governments don't want to acknowledge what's gone wrong and take responsibility for it, that's going to make it very, very hard for governments to rebuild or to build for the first time trust, because they will not admit the mistakes and the lies that they told the public, even though everyone knows about them.
Why are mistakes not just spilt milk, though? When you have got to get on with the more serious job of communicating today's information, why spend time debating yesterday's mishaps?
So people will trust that you're going to be honest this time, or at least give you a chance.
And it doesn't risk confusing the communications, to your mind, no?
We say that the public is confused when what we really mean is that we're communicating badly with them. We blame the public for being confused when what we're doing is saying mixed messages and things. So I actually don't subscribe to the notion of the public being confused. I subscribe to the notion of the public being misled.
One of the very interesting things about the way that this pandemic played out from the public's media consumption point of view was that they got to see, if you like, in real time, scientific debate and the science changing. Something that would usually end up happening behind closed doors ended up being played out on the front pages of national newspapers. What do you think that did to the public's faith in science?
I think it helped. That's one of my very favorite topics of the entire pandemic, is the public, scientists putting on their show in front of the public. I think the major impact of that is very salutary the public will have a less exalted view of scientists. And I think that's appropriate because scientists are just like everyone else. They are, and almost all my friends are scientists. I love them. But scientists like to say, oh, we're rational and the public is hysterical, or we're rational and we use reasoning and the public is irrational. The public got to see scientists being vicious, nasty, irrational, changing their minds, arguing with each other, all things that we should do behind the scenes because it's one of the ways that we duke things out. The public got to watch that. The public can no longer grant the scientists the mantle of rationality. That is over.
Is that a good thing?
Yes, because it's reality. The public has a more realistic sense of what scientists are as people.
But arguably where we find ourselves in a scenario where politicians, and I'm thinking of the Trumps and the Bolsonaros and the Lukashenkos and even the Johnsons of this world, were communicating messages that were very often at odds with the science. Did we not need the scientists, frankly, as some kind of a reliable, authoritative father figure that we could turn to?
Well, you know, that would be nice. It reminds me of Mahatma Gandhi, who supposedly was once asked when he first visited the West, what do you think of Western civilization? And he answered, that would be a good idea. No, scientists cannot be paternal because that's treating the public like children. The public has to get used to the fact that, and you even used the expression a minute ago, Philip, the science. There is no the science. There's a lot of sciences. And so every time we talk about the science, we're pretending that we are a unified group who knows things. The public can handle the fact that scientists are in arguments with each other. Some say close the schools, some say open the schools, some say children can't transmit, some say they can. You know, you all know this whole list. We could go on and on. When scientists fight about these things, it's really good in my mind for the public to see it. It's not good for the public to see how vicious the scientists can be about it and the ad hominem attacks and the name calling. But in terms of the arguments, it's a big improvement in my mind for the public not to have the scientists on the pedestal.
This is now obviously the perfect point in this conversation of which I introduce one of the scientists, Professor of Theoretical and Evolutionary Biology at the University of Washington, Carl T. Bergstrom. Before I do introduce Carl, let me just suggest to people who are listening in, if they want to participate in the conversation now, if they want to suggest questions for me to ask right now, or to have debated later on at about 9 o'clock or so, please put them into the chat box and myself and Barbara will sort through them. Carl, Jody has just dragged you and your colleagues through the mud there. Does she have a point? Was it a good idea that we got to see that you guys had feet of clay?
How did she drag us through the mud? I think it was a very accurate description of what happens, and I didn't think it was hostile at all. I mean, I think there is admittedly a question about what was the public impact of seeing more of how science is done revealed. I'm with Jody that largely it's been a very positive one. So I guess I don't really see that as her remarks as being critical of science whatsoever. I guess that might be where I'd start.
Well, let me put it to you then as a journalist or even just a member of the public. I found it very disquieting to see scientists so openly disagreeing with each other and so very often resorting to ad hominem attacks throughout the course, particularly of the early stages of the pandemic. Did you not have concern about that?
Well, okay, so I mean, open disagreement is the nature of science. It's essential to science. And I think one of the things we have to recognize is, particularly in this case, we found ourselves in this massive uncertainty vacuum where, we were in February of 2020, we were confronting a disease that had only been in humans for what, 2 months, 3 months at most. We knew almost nothing about it. And there was not time to stop and study it carefully before making prescriptions. We had to take the information we had and decide what to do because we have an exponentially expanding pandemic, and we couldn't sit down and study and figure out what we wanted to do based on all the data we would have liked to collect. And so that means that we had to use hunches. We had to make estimates. We had to base things on our differing priors of what was likely to happen. And so, of course, there's going to be disagreement there because the science isn't resolved yet. And so we've got this uncertainty vacuum. And so, of course, you're going to have intense disagreement. And I think one of the things that's nice to see for the public is that, there is no single, unitary science that's deciding from this paternalistic perspective, oh, this is what we're going to do, and we're all going to toe the party line, and we're going to promote this particular, version of the truth because some, organization says that that's what we're going to be presenting. Now, the one thing that you do mention was the frequency of what you describe as ad hominem attacks. I think that there was very intense disagreement. I think that the ad hominem attacks were rare and perhaps generated more attention than more public attention than was deserved. I also think that there was a very when people were criticized for doing, frankly, irresponsible work, and maybe you could consider that an ad hominem attack on my part, but when people were criticized for doing irresponsible work, they'd say, oh, I'm being attacked ad hominem. No, you're being attacked for doing work that was very shoddy, and then staging press conferences to promote that work and dismissing the criticism of your colleagues. That's not ad hominem. That is saying this is poor work that is not adequately justified and is getting excess attention, and we disagree with it. So, I mean, I think that there were a small number of ad hominem attacks, but I think in terms of people saying that if I say that Gideon's work is poor, it's not, it's excellent. But if I say Gideon's work is poor because he failed to consider X, Y, and Z, that's not an ad hominem attack. That is pointing out that Gideon's work is poor. Again, it's not, but you see what I'm saying. And so I think that that the fact that I attach a name, a person who's promoting a set of ideas to that set of ideas, that doesn't make that an ad hominem attack. If I say, oh, we can't trust Gideon because he has a cat, now that could be an ad hominem attack, but I think there was relatively little of that.
But I wonder, in saying that and constructing what you said in that way, are you aware, are scientists, your colleagues generally aware of how that tends to play out in media? Because what we in media love, so very often failing to understand the principles that you were discussing, is, oh, scientist A and scientist B are at loggerheads with each other. We're going to report the argument rather than the ideas behind it.
Well, I mean, that certainly there is some concern about that. I think we because we had, I mean, science changed a lot during this pandemic. We had to work very, very rapidly using the technologies that we had available to us and self-organize on a much larger scale. It was really an all hands on deck kind of situation. And we had to find ways to do it. The way we ended up finding to do that was largely in public venues for the first time. So preprints became much more important within medical science than they'd been in the past. They were common in other areas, but really kind of backgrounded in medical research for various reasons. And then, of course, these public discussions on venues like Twitter, PubPeer, and so forth were also laid public. A lot of this would have been done in the past at conferences by email chains and so forth. And I actually think, exposing this was good. You're right that then, creates the appearance of a tremendous amount of controversy, but that controversy is real. And that is the fact that there is uncertainty in what to do next. And so I think one of the mistakes that we all made and I don't want to blame science or media differentially, but I think we all struggled with conveying the degrees of uncertainty that were present. And so, one of the things I noticed very, very early on was you'd say, oh, what's the infection fatality rate? And so, most reasonable scientists, I remember so well talking to this one reporter, and the reporter was saying, I'd spoken to someone at the CDC and they wouldn't give me an infection fatality rate. All they'd say was it was somewhere between 0.5% and 5%. It's like, there must be a cover up. And I'm like, no, you just talked to somebody honest for the first time. It's like, they don't know. And, but what happens, of course, it's much more interesting if someone will say, oh, it's 2.2. And so that gets attention. Even more interesting if someone says, oh, it's less than flu, or, oh, it's worse than Ebola. those get attention. So what happens, you have this uncertainty vacuum, and into this uncertainty vacuum, you have so many things that come flooding in. You've got sort of organized disinformation, you've got disingenuous governmental messaging, you've got all these fake studies and astroturfing, dreadful preprints, dreadful peer-reviewed work, sloppy reporting, cherry-picked examples, careerist individuals, complicit social media companies, all that comes flooding in, and both scientists and the media ecosystem are struggling to deal with that, when what really needs to be presented is this story of, we don't know the answers to this yet. These are the ranges that we think are going on. There are reasonable scientists on both sides of this opinion. And then when someone comes and starts saying something really stupid, like you need to inject bleach or something like this, then you can say, well, that's stupid, and everyone agrees that's stupid. So, I mean, I think that's, the presence of the disagreement among scientists really absolutely is a very positive thing. And the fact that disagreement gets extremely heated in times where there are a tremendous number of lives and livelihoods at stake shouldn't be particularly surprising, I think.
Your book is called Calling Bullshit: The Art of Skepticism in a Data-Driven World. Help me out in understanding the motivation of the bullshitters, if you can, because it can't all just be about clicks and likes, or can it?
Well, I think there's a whole wide range of motivations, right? I mean, there are a lot of true believers. A lot of people have true opinions about, they truly believe what they're promoting. And it becomes very easy to fall prey to confirmation biases and things like this. Something's right, and now your job is, it in your heart, and now your job is to convince other people, and you accumulate the data that support that, and you put that argument out there. Turns out, in your heart might be wrong, but you feel like you know it, and to some degree, science is often very self-correcting in this sense. You have a bunch of people that kind of are passionately following their own hunches and their own intuitions, and then they battle it out in this kind of marketplace of evidence, right? There's so many motivations, though. I mean, obviously, early on we were tracking some of this. There was politically motivated propaganda to try to discredit the Chinese Communist Party. So there was these stories of sulfur dioxide blooms over Wuhan that were suggesting that hundreds of thousands of bodies were being cremated, and all of this kind of stuff. Later on we were seeing all kinds of evidence to being manufactured to try to take the pressure off of the non-reaction by the U.S. government and other governments. So, hydroxychloroquine would have saved the world, but the doctors wouldn't admit it. It's not the fault of our non-reaction. It's the fault of the doctors wanting to go with their evidence instead of this miracle drug that was out there. So then you see, so that's a different set of motivations. There are people that see crisis as a career opportunity and rise to prominence either by promoting mostly good information, but kind of without carefully filtering it, or in some cases by being just straight up grifters, presenting absolute falsehoods. So there's such a range of motivations out there, and it's a really complex ecosystem. So I don't think you can pin it on any one particular thing, but just you have to look at the complexity of it all.
If we could simplify the ecosystem, if I could make you president of the world for a day, what would you most like to see changed? I mean, maybe in terms of the way social media companies reward their members or their subscribers for sharing bullshit. What is the thing that you think comes closest to a silver bullet?
That's a very, very hard question. I would like to see governments, I'm going to come back to Jody's point. I would like to see governments step up to their responsibilities to tell the people the truth about an oncoming crisis, rather than trying to manage it with untruths, so as to defer the problem.
And the obverse of that the legitimately expressed feeling within government behind closed doors, we don't want to spread panic. You weren't sympathetic to that?
No, because when you take that approach, I mean, you undermine credibility in the government dramatically. I mean, the amount of soft power that the U.S. burned early in this pandemic by having different government agencies saying different things. There was a day when you had Trump saying, there's only 15 cases, then 10, it's going to go away. Larry Kudlow is saying we've got this completely under control. The same day, the CDC is saying this is going to be a bad news. The American people are going to have to, kind of settle in for the long haul. This is going to have dramatic impacts on the lives of Americans. And this is a complete disaster from communications perspective. This is exactly the aim of sort of the falsehood fire hose strategy of propaganda, is to put out multiple competing, mutually contradictory stories so that people despair at getting to the truth. And when you have that coming right from the top of the government and the leading agency that's supposed to be doing that, and they're telling opposite stories, it's an utter disaster in pandemic communications. And handing you couldn't do something better for the propagandists than making a mistake like that.
Talk to me a little bit about preprints. I think I understand as a scientific layperson the virtue of making as much research available to as many different scientists around the world simultaneously as is possible, with all of the caveats that you as scientists understand. But some of my perhaps less scrupulous colleagues thought that this was a great wellspring of stories, that there was, any amount of poorly researched, poorly statistically backed up stories to be extracted from preprints. Do you have reservations? Do you have any ideas about how we might put health warnings around preprints in the future?
Well, I think, first of all, I think it's unfair to pick on preprints there. I mean, if we could go straight to the peer-reviewed journal literature, there's a paper in the peer-reviewed journal literature that explains, proposes a biochemical mechanism by which 5G causes the spontaneous formation of viral particles within your body. This could not be more spectacular bullshit. There's no grounds to anything like this at all. It's ridiculous, but it was published in peer review. There was a peer-reviewed paper in one of the top medical journals in the world that said that hydroxychloroquine was having these very negative effects, causing mortality, higher rates of mortality among people receiving it. On the basis of that paper, the hydroxychloroquine trials were canceled in a number of places. Now, it wasn't going to be a miracle drug at all, but it's a shame that these trials were canceled because of this publication in a top venue, because, as it turned out, all of those data were fabricated. So it is true that there's a lot of garbage in the preprint ecosystem. There's a lot of garbage in the post peer-reviewed ecosystem, especially when you're moving things rapidly through peer review under a crisis situation. So I think the more general thing is, for both peer-reviewed papers and non-peer-reviewed papers, the really critical thing is to understand that each paper that's published is not a final and decisive answer to how something works, but rather, in the words of one of my colleagues, it's a pebble on the scale of evidence, right? So you've got evidence for and against two different hypotheses, and each paper that comes out just a pebble on one scale or the other. But so often the papers are presented as, and that's a boring thing to put in the news. It's, new paper comes out about school transmission. Most scientists shift their priors from 43% to 47%. Super boring headline. Kids transmit COVID. Exciting headline, but not an accurate representation of how that latest paper is contributing to the overall understanding. So I'm not trying to pillory journalists for this here, because I understand that the idea is to attract attention. We have to think about the broader media ecosystem and the role of click-based advertising, among other things, in pushing that kind of hype. At the same time, the problem is absolutely not that a few people put really crappy preprints up. That were, in most cases, in almost every case where there were terrible ones, like the early on one claiming that they're part of the HIV genome in SARS-CoV-2. This was, of course, completely false, based on a misunderstanding of how to use these genomic tools. This was debunked and retracted within 2 days. So I think the bigger issue is to understand how to contextualize work that's being put out in this uncertainty vacuum, in a crisis discipline where we've got to act before we have a complete understanding of what's happening.
Which is an excellent point then to bring in my colleague Meg Tyrrell, CNBC senior health and science reporter. Meg, before we get on to that issue, you had in the United States, you as journalists, had a particularly difficult pandemic when you think about how President Trump conducted himself. Can you talk me through how it is that you adapted to that situation from January on?
Well, this has been just fascinating. And I have to say, I'm very impressed by you several hours after your second shot, doing so incredibly well and asking such wonderful questions. You look great and you're doing awesome. I felt terrible after mine. It was really weird. At the beginning of this, I approached it like it was going to be similar to how the CDC handled Ebola or Zika. But, Ebola, when it was in West Africa and there was a case that came to the United States. I mean, these are scales that are just so completely different, obviously, from what we're in now, but they held regular media updates every few days. Tom Frieden, was in Texas where the patient was. He was the CDC director at the time. We went there, we could ask him questions every day. Everybody was available to us. There was so much communication. At the beginning of this in the United States, the CDC was doing that to some degree. Nancy Messonnier was leading regular updates, and then it became the end of February, and she made the mistake of warning us that it was a matter of when and not if this was going to affect us here in the United States. And we didn't hear from her again for months, if not longer. And it became just mind-boggling trying to cover this, and watching Larry Kudlow, who I used to work for CNBC actually, say that this was contained, and the president saying, we only have 15 cases and it's going to go to 0, and then you have the scientific community saying that's not true. And so at some point you had to stop relying on the CDC. We realized that we couldn't rely on the CDC to cover this anymore, and that was kind of bonkers. I mean, we started having to rely on alternative data sources. Thank God for Johns Hopkins and their tracker that they made. Thank God for the Atlantic, which made the amazing COVID-19 tracking project so we could follow the cases and the testing and hospitalizations. This was like water to starving journalists. And I bet you guys in the public health community, I mean, we had no idea what was going on. And it was so hard to follow, and you couldn't trust the usual sources of people to follow. So we just started cobbling together these alternative sources of good information. And I'm so grateful to the scientists here on the panel who spent so much time helping us. And that could be so hard too, because you guys, I can't even imagine the volume of emails you must have been getting and phone calls. And every time somebody took the time to write back to me, that was like water too. It was just, so helpful to get some direction. But it's weird to think about it now, but it was just so crazy at the beginning. The people you usually relied on, you just couldn't.
I think it was January of this year, maybe a little bit earlier, before I first saw an American network. In fact, it wasn't a network, it was NPR, National Public Radio, effectively calling bullshit on Trump and interrupting one of his interminable press conferences to say, we're breaking away from this because the president is saying things that can't be supported by fact. Can you describe the editorial process to us in your newsrooms? At what point it was that you realized that you were going to have to be in the business of essentially live fact checking a president?
I don't know, is the bleach line, the sort of dividing line of before and after? I mean, no, it was clear from the beginning, the trying to downplay that the things that the president said were not based on, what he was being told by Dr. Fauci and his other scientific advisors. He was saying what he wanted to say to get the message he wanted to get out. I wasn't making decisions on behalf of our network to whether or not to take the press conference. I was reporting on what was going on. And so I'm not sure how those decisions were made, although I do remember, Shepard Smith just started with CNBC last September, and he used to be on Fox News. And, we're generally a business news network, but Shep's show is at 7 p.m. And he did that, although I don't think it was with COVID, actually. I think it was more about the election, but he went to a press conference and then went away from it. And so, I do think that we all made that shift, but whether it was around COVID or whether it was around the events of January 6th, I think things started to change with how we, as a group, broadcast industry started covering the president.
Tell me about your personal attitude to how we tackle fake news, because I think The agreed consensus within most media circles tend to be that the best antidote for fake news is just for reputable networks like CNBC to put out good, factually based, sound evidence for the public to consume, and that if you go chasing off after each individual fake news story and try and disprove them one by one, you're really going to only end up chasing your tail and allowing these people to set your agenda as opposed to you setting it. Is that the right response, do you think, or is that perhaps a little bit too timid?
I think there's a balance that has to be struck, and I don't know if I've reached it. I'd be curious to know how you deal with it. But it's happened with a few specific problems that I've been asked to work on, that I've approached and thought, oh, I'm uncomfortable with this. I don't know how to cover this story without reinforcing the fake information. The example I'm thinking of in particular is that the vaccines are connected to infertility. And it was getting to the point where we were starting to hear this from local health departments around the United States, volunteering that this was a reason that young women in particular weren't getting vaccinated. And as that started happening, I became more comfortable addressing the fact that this myth was out there, and then tried to cover it in a responsible way so that I wasn't reinforcing the idea that this could even be possible. But you also don't want to write it off and make it seem like you're part of this cabal that's just hiding information from people, because I think there's a real attitude among a lot of Americans that is happening, and that the media is part of it. So trying to handle it sensitively without reinforcing it has been a challenge. But I think it's important when there's something that rises to that level. For every piece of fake information, I don't think you can.
Talk to me then about specifically some of the mendacious reporting, perhaps, around vaccine and mask efficiency, and again, how it is that you have chosen to deal with that. Is it by just putting out the best scientific evidence, or do you feel obliged to say, look, whoever it is that is telling you this is just wrong and has their own reasons for saying it?
I think as much as you can, you have to provide context of the information as you're putting it out, but I have failed to do that at times myself. I remember, thinking about your first question about fact checking the president in real time. I used to live tweet his, COVID briefings, and I was basically doing it to put what he was saying about the pandemic out there in sort of a live public record. And I got a lot of criticism for that. And then I tweeted back, I'm trying to record what the president is saying about the pandemic. And then I got outrage from the Trump White House, who seemed to think that I was an ally to the Trump White House and how I was covering this stuff. And I started to think about the pushback that I was getting to it and thought, okay, I understand why there's pushback to this, because I am reinforcing words that aren't true in a perspective that is not based in fact.
Lending CNBC's credibility to what the president has said and effectively being a stenographer.
Yeah, exactly. And more recently, there have been cases like, for example, the Yankees had all these breakthrough infections. A lot of the Yankees were vaccinated with the Johnson & Johnson vaccine, and there were a number of breakthrough infections reported in the Yankees. And I also tweeted that piece of information without context. And sometimes the reason I do that is because I don't have the context at the time, but it's news that's just coming out and I want to get it out there. But I can see how that leads to misunderstandings of what it means. There's a lack of context where, among how many people, why would you expect there to be breakthrough infections? The Yankees are getting tested all the time. Trying to explain why things like this are happening and what it actually means would be more helpful. And as I approach Twitter and I approach my job on CNBC, I do actually approach them a bit differently. Whereas I wouldn't just go on CNBC and say this and not have any context to try to explain the meaning of it. But I sometimes do that on Twitter, and something I need to work on.
So I was just going to say, have you started correcting yourself on it now? Because it's impossible for anybody of malign intent to take one single line from one of your reports and make something of it. But they can take a single tweet of yours and they can say, look, this is an endorsement of what it is that I'm saying from CNBC.
Yeah, it happens all the time. And I don't think you can correct for every possibility of somebody doing that. And certainly none of us tweet perfectly. And I'll make a lot of mistakes, but it is something that I try to think about. How can I present this information in however many characters they allow us on Twitter now by giving context? You know, today I'm reporting on the CDC's advisory committee meeting about heart risks in adolescents and young people. And, I see the numbers out there. A lot of people are like, oh, there's 1,200 cases reported after the mRNA vaccines. It's like, wait a minute, just like read the slides. There's 323 among 20 million people who've been vaccinated. And here's what we know about the risk. And so there's just so much more context, and it does exist. And so if you can take the time to try to provide it, it's important.
Okay. Last question to you, but it's a pretty thorny one. We in media, journalists generally, are very resistant to outside editorial regulation of any kind. But given some of the BS that was put out there by sometimes supposedly credible news outlets during the course of the pandemic, is there a case to be made in the future for allowing expert or independent or even government editorial advice or regulation when we find ourselves in a scenario like this again in the future? Or is that the start of a slippery slope?
I don't think it's realistic here in the United States. We just don't operate that way. I think that some places are not going to change as a result of this. And I'm not sure what to do about that. But I think that some places have beefed up their science reporting teams. And I think the importance of learning from a team of science journalists. I worked at Bloomberg News when I first started in journalism, and I worked on a big team of health reporters, and they taught me so much about how to read a study, how to call experts and get outside opinion on the study before you put the story out. And I see that happening all the time, where people just write something based on reading a headline and don't get context, and it's terrible. So what I hope is that there will be a building up of science desks and help desks and teams of experts who can help one another and help younger journalists know how to report on these kinds of things responsibly and well.
Thank you, Meg. Muge Chavik, clinical lecturer physician, specializes in infectious diseases and the Chief Medical Officer of Scotland. Can I ask you, just purely in terms of the communication here, do chief medical officers, do chief scientific advisors of governments, Muge, sit down and watch their counterparts around the world and learn lessons from each other and how to and how not to communicate the science? And if so, who are you most impressed by?
Thank you so much. There's already, I think, so much disagreement within the room among scientists, even advising the government. So often, there's different views, different discussions already. But also my role as an advisor, scientific advisor, was bringing in international discussions and international data to the team. So most of the time, I think I could talk from a UK perspective, but we often rely on our own data. So there's been a lack of understanding what's been happening in other countries. And that's one of the gaps I've been filling in within the advisory group, bringing in the discussions and data.
So did you find yourself becoming quite introspective and quite focused on your own data to the exclusion of what was happening elsewhere around the world? Was that, a necessary function of there only being 24 hours in every day for you?
So, I mean, often my role was not only just, generating my own data, but also understanding what was happening around the world. So I think, being part of some of the research consortium with other researchers as well helped kind of understand the discussions for me. In terms of science communication, I think coming back to your initial question in terms of communicating the science as advisors, I think overall, what I've seen is that there's been a paternalistic view that public doesn't really understand uncertainty or doesn't appreciate that. And I think that's what's been discussed previously. As a clinician and independent researcher, I feel that public very much interested is in science and uncertainty, and they have so much understanding about the nuance. But I think that needs to be communicated. And overall, I think throughout the pandemic, one of the things that I observed is we're kind of losing the sight of the overall picture. I kind of call it chasing unicorns while missing the big picture. Like we always talk about like outdoor risk or like small risks. People are feared about small risks while missing the overall picture. So I think putting everything in a context was kind of one of my role, and I kind of put myself in that role initially at the beginning of the pandemic. There's been a lot of uncertainty, lots of information coming from different sites. And one of the things that I was doing as a clinician and researcher was just putting, information on Twitter, kind of putting everything into a context in a way to try to see that overall picture. But I feel that, it's really difficult in advisory groups, I think, to understand what public feels about all the things going on, and balancing the risks and benefits of all these interventions. But I mean, I'm basically part of a very small subgroup. So I'm not on the SAGE. Basically, I don't know all the discussions going on there. But at the end of the day, most of the things we're feeding into the government's decision making is based on data, based on what's basically we're generating and all the discussions being done within the advisory group. But I think it could be limiting factor in a way if people are not very much in contact with other international researchers. I agree, yeah.
On the one hand, good science is about gathering as much data as possible, spreading your net as far and as wide as possible, and getting all of that information into the one place and analyzing it comprehensively. And on the other hand, good communications is about refining and distilling and making as short and as concise and as brief as possible that which it is that you want to say. Are those two things completely antithetical to each other, or how did you wrestle with them in trying to work out what the daily message should be?
Yeah, I mean, when it comes to, I think, synthesizing data, yes, I think you need various data points to understand the overall picture. But at the end, there's a message, the data basically tells us a message. I mean, at the early phase of the pandemic, it was around May, everyone was concerned about like passing, strangers or cyclists catching, COVID from outdoor, brief contact. And then, when I reviewed all the contact tracing data, it kind of was very clear that all the transmission was happening indoors. All the transmission was happening in prisons and workplaces and, homeless shelters. So it kind of, I think data, if it's synthesized with an objective eye, it kind of tells you a story at the end. And there's been a lot of, emphasis about other things which, not very much, important, but yet the headlines like, beaches and transmission in beaches and things like that. But whereas like we've heard very little about socioeconomic inequalities, living working conditions of people. I mean, we still don't have self-isolation support in the UK, for example. So I think like when you analyze and synthesize all that data, it tells you a story. And one of the things, and another thing I was involved in was kind of reviewing the data about when transmission happens, when people are most infectious. And when we analyzed the data, we found that people are very infectious really early on. And that's the reason, we need to be very prompt in terms of self-isolation. We can't wait for, people to test like 10 days in the course of their illness. So those are the things that it's been fed into kind of, data and decision making. But at the end of the day, that decision making basically needs to consider other things. It's not only about science. That's one of the things that I've learned, during this pandemic. Policy making and also communicating that science is not only about data. It comes back to, trust. I think that's one of the things that's been discussed. And it's not only about the, trust about what we're saying during the pandemic, but also before the pandemic. The second thing is, I think, learning from each other, other countries, especially. I think one of the things in the UK we could have done better, learning from others' experiences. And the third thing is, I think, being open and acknowledging that uncertainty. So those are the things I've learned. And at the end of the day, that policy making is not only about science. It's about economic aspects, socioeconomic aspects, and social aspects. And it requires multifactorial understanding about science and how it has an influence.
One of the things that I'm becoming increasingly conscious of as we keep on talking here is that we're almost putting this pandemic in the past tense. And of course, we're very far from out of it as of yet, particularly with concerns about the Delta variant or the Delta Plus variant. Have you got any smart ideas about how we communicate the nature of the threat presented by those variants to a public that are now primed for release from all restrictions in a matter of weeks, if not days?
Yeah, I mean, I think, as I was saying, we need to acknowledge uncertainty, but also we need to acknowledge things that we already know. And over the last 1.5 years, I think we've learned a lot about transmission, where the transmission occurs, and some of the mitigations that work. And in terms of vaccines, we're in a much better position than last year. We know that, even against the variants, they work pretty well. But there are certainly many unknowns. So I think one of the things that we know at the moment, and we also don't know, in a way, is the vaccine equity and how that will, influence how the pandemic will play out. I think one of the things that's been maybe miscommunicated is that, I think, when we say the virus, when it spreads among people, it will generate more variants, but actually the variants don't evolve in healthy individuals. It evolves in clinically vulnerable adults. So first and foremost, the idea of vaccination should be to prioritize clinically vulnerable adults in all countries. That's how we can slow down the emergence of variants. And unfortunately, we're not doing that. So I think we may see more variants coming, but that's the nature of the virus. And this is the first time, probably in history, we're basically rolling out vaccination in the middle of the pandemic. In 1918, they didn't even know what virus they were dealing with. The scientists couldn't, culture the virus. They didn't have the vaccine during the pandemic. Everything basically, it became clear after the pandemic ended. So at the moment, we're basically rolling out massive vaccination in a population where the virus is still circulating, the prevalence is still high. So we may see more variants. We may see, even, variants that will be much more making our vaccination efforts difficult. So I think overall, I'm hopeful for countries that manage to do vaccination rollouts, like, for example, UK, US. I think we will be in a much better position by this winter. But I think globally, it will be very, very difficult. I'm not sure when the pandemic will end as a, kind of globally. Because there are so many countries where we don't have vaccine coverage, even for healthcare workers. I have colleagues in Kenya, Uganda, they haven't had the vaccine and they're working on the front line. That's makes me very, sad and in a way angry, because in a way, like we're talking about Freedom Day, for example, in the UK, whereas like there's so much going on globally, and this is a pandemic, and we need to have the solutions globally, I think, as an international community.
You make me feel guilty for asking a kind of a parochial question now, but I really feel that I have to, because there are some interesting parallels between Ireland and Scotland, not least that you share an open and dynamic land border with a neighbour that determines its own health policy, and you determine your own health policy too. You came pretty close in Scotland at one point in time to zero COVID. I wonder, do you think that that is a realistic strategy to pursue, or is it just not something that is in the political or epidemiological gift of either politicians or scientists?
Yeah, well, I mean, I think, yes, Scotland was very close to having low levels of infection. I guess, like, I don't know, everyone has a different terminology for zero COVID and understanding about zero COVID. But what I feel is that, we have certain understanding at the moment after 1.5 years. I think one thing we now know for sure is that SARS-CoV-2 is going to be with us for a long time. So I think my grandparents might be infected with SARS-CoV-2. So from a virology perspective, this is a virus that will probably become endemic and seasonal once the vast majority of the population gets immunity. So that's one thing. And the second thing I feel is that the storm will pass, but the choices we make could change our lives for years to come. And some of the things that we've done during the past year, like for example lockdowns, have saved so many lives, but in a way we need to kind of consider the pros and cons of each intervention. I hope that we can start empirically assessing what did and what didn't work, and what contexts were in place to facilitate those strategies. And at the end of the day, we can all agree, even while achieving zero COVID, some of those public policies implemented based on the assumption of equal risk of acquisition, across all socioeconomic subgroups, expose higher risk of infection among some communities, especially economically marginalized communities. If you look at Scotland, Ireland, UK, US, Australia, it basically matches deprivation. This is the reality of transmission. That's what's been happening, and these are consistent findings. And I think we need to come to a level that we assess benefits and harms of all the interventions. And we have the data at the moment. We can look at it, we can analyze it, and at the end of the day, I think when we decide on any intervention, it's not only sufficient to ask how many people will fall sick if we don't do this intervention. We need to also ask, like, how many will lose their job, how many will miss school, how many people will suffer from bad nutrition and depression. I know that, I think COVID has become the most important thing, but I think some of the, overall harms, we may not really see it in the short term. It may happen in like 10, 20 years time, and how we're going to assess that, how we're going to recover from this time period. So I think I think overall, now we have the vaccines, we need to balance the, pros and cons of all the interventions we're doing. And going forward, I feel that, there's something called APs. Any intervention needs to be, affordable, first of all, acceptable by the public, and other interventions needs to be not really disrupting the overall, lives of people. Overall, I feel that, people need to understand what to fear, what not to fear, and what's important, what's not important, because I don't necessarily want to see people fearing about, for example, outdoor risks versus sitting in a restaurant. for hours, for example. But going forward, people need to understand what's my risk, what's the overall effectiveness of vaccines, what's the local prevalence in my area, how I can protect myself. And I think these are not really complicated. I think people understand the complex stuff, and people understand uncertainty, people understand when to take measures or not. But I think it needs to be communicated pretty well. I hope I answered your question, sorry.
No, you have, excellently. Thank you very much. I want to bring in Gideon Meyerowitz-Katz in the University of Wollongong in Sydney now, and it probably is something of a cruel and unusual punishment, Gideon, to get you up at o'clock and then make you sit there to be the last contributor. But I was under strict instructions to save the best for last. And I have an amazing quote from you of yours that I want to read back to you. The ultimate year of contrast for science, with some amazing highs, including some awe-inspiring basic science and epidemiology, as well as lows. This was your description of the year 2020. What were the highs and what were the lows for you?
I think it's an interesting question, because it's really easy to start thinking of some highs, and everyone who's spoken, I think, has mentioned some of the amazing work that was done. I was thinking about the CSSC dashboard from Johns Hopkins University that was mentioned a couple of times earlier, because when I came into work in March 2020 at a hospital in Sydney, and my colleagues who are doing the contact tracing in day-to-day work before the pandemic, and had suddenly been thrust into doing contact tracing for an emerging pandemic in the middle of the city, they were loading up the CSSC dashboard from America to look at the global situation. And I mean, that is like an amazing feat of I guess, scientific engineering that helped people across the globe and is still helping people across the globe today. I think the vaccine development has been truly impressive, not just the massive phase 3 trials that usually take years to run, that we kind of just removed all the barriers for and did in under a year, but also the basic science, the ongoing basic science that's still happening now into new vaccines and developing better vaccines against variants. And then we've also got some amazing trials like Recovery and Solidarity. The sort of thing that usually takes decades to do, we've managed to condense into 6 months or less, and produce evidence that clinicians can use across the globe to treat people with a completely new disease. And while it's true to say that a lot of that is just removing barriers, right? We're just taking away things that get in the way of these amazing studies. It's also true to say that the people involved in those studies didn't have to do them and have done amazing work. I mean, I guess one of the lows is that a lot of this is not directed by official organizations. It's not necessarily the responsibility of the people, or rather the governments that should, in theory, be doing these pieces of research. It has been often individual universities or groups of researchers who've just said, well, there's a problem, we can fix that. And actually a great example of that is in the United States. When we were looking at seroepidemiological studies for our review, looking at infection fatality rates. So this is, studies of antibodies in people across the country. One of the best studies was done by a business school in Utah, at the University of Utah. Just one of the most robust, well-done epidemiological pieces of research in the United States during the pandemic. And it was very much not the official authority who did it. And I think that's an amazing example of both a high and a low.
I don't understand that. Does it surprise you? Because I can't imagine that it should do, but does it surprise you that that governments were trotting after university departments and scientists? Because surely you are the people at the cutting edge with the best ideas.
Look, I work for the government, and so I know the endless red tape that the government can put in front of people. This is true of all governments that I've worked with ever. So I can understand why universities have been in some places at the forefront, but also I have to say, yes, I was surprised, particularly early on in the pandemic, that a lot of the research wasn't coming out of of governments, who in theory, this is the responsibility of the CDC, say, or of the Australian Department of Health. And while they've done amazing jobs in many ways, I do think it has been fascinating to watch universities, and in this case, the one I was talking about, it was a business school. It wasn't even, the infectious diseases college at, I guess, Stanford or Harvard. It was just the Utah Business School doing the best study in the United States at the time. And yes, I think I was a little bit surprised at that.
Okay, let's go back on some of the issues that came up with the discussions with the other contributors, please, if we can. This issue of preprints and how they end up getting communicated, or even, as Carl was saying, just badly peer-reviewed, published science as well, that then hits the front pages of the newspaper and becomes accepted public fact.
Yeah, so I would 100% agree with Carl. In this context, I don't think it's fair to be overly antagonistic towards preprints, because the scientific literature contains just as much nonsense as preprints do. Preprints perhaps are less reliable in some ways, in some specific ways, but they are not necessarily less reliable than published scientific research. And I think a fantastic example of this, and a big low, one of the biggest lows of the pandemic perhaps, is the hydroxychloroquine drama. So my friend had a great quote, James Heathers. He said that hydroxychloroquine will be studied by future historians of science as a kind of moment of insanity during a pandemic. In a decade, people will be doing their PhDs on how hydroxychloroquine became this massive treatment and how it's still being used a year later when we know it definitely doesn't work. Because the research, the original research that came out, it was peer-reviewed in a day. It was published almost immediately, and it was a very kind of vague observational study that said, well, any reasonable scientist reading that would look at it and say, well, this doesn't tell us very much. And yet, overnight, became a global treatment for COVID because we were all so desperate for anything that could work. It was promoted by the President of the United States, famously, and millions, if not hundreds of millions of people have received it over the last year to treat COVID, particularly in the developing world where the more expensive treatments that we enjoy are not available. And we now know that not only does it not work, it most likely increases your risk of death from COVID-19. So there's a very large systematic review from an international collaboration. This is largely based on the results of the recovery and solidarity trials, but that identified an increased risk of mortality from hydroxychloroquine. And so it's a modest increase, but it is still fascinating how we went from what was objectively kind of vague and not very convincing science to a treatment that everyone has used. And in that mix as well, we've got the surgosphere drama, which was also referred to earlier, where people published in two of the leading journals in the world 2 studies that almost certainly were based on a database that never existed in the first place. And there are also, to add to this, I mean, those are the famous examples. There are hundreds, if not thousands, of terrible papers on hydroxychloroquine. And most of them are positive. Most of them are these papers intended to kind of give the impression that hydroxychloroquine works. Several have been released even now, even in June 2021. And we're still arguing the same point a year after we demonstrated, after the recovery trial demonstrated that hydroxychloroquine probably is ineffective to treat COVID-19.
What would you like to see happening in media outlets? I mean, does it horrify you that people like me with degrees in history, politics, and history of art ended up reporting on things like hydroxychloroquine as it first emerged from the United States, and that basically you don't have people, by and large, populating most newsrooms with a good science grounding?
It does not horrify me at all. In fact, a year ago, just over a year ago now, I organized with my friend Melissa Davey from The Guardian and another friend, Felicity Nelson from a local magazine, an information session for journalists reporting on COVID-19, because I think the challenge is that often the people who are best at explaining things do degrees that aren't necessarily scientific, and the whole point about journalism is not to be a scientist, it's to be able to take things that are hard to communicate and to communicate them well, and to represent both sides of the story, I guess, or to represent the challenges in understanding there. So I think journalists, generally speaking, have done a very good job at coping with this massive onslaught of new information and the incredible difficulty of coping with the global pandemic. I mean, obviously there are exceptions, and then there are some stellar shining stars who've done just truly amazing work during COVID.
Okay. Let me make the same offer to you then that I made to Carl, and make you president of the world for a day. What would you implement immediately? What would you have us do differently if we could rewind the clock to December 2019?
I think it's a point that pretty much everyone has touched on, and I don't know if I can encapsulate it in like a single action, but basically I would love for our communication and understanding of uncertainty to be better. One small example of this, a tiny example, my friend is a journalist who works at one of our larger local papers in Australia, and I've convinced him to add confidence intervals to all of the estimates he presents in the news, and that is a very small change, right? It's just saying this is 10%, and it goes between 5 and 15%, and yet it makes a huge difference in how people understand the number. It completely changes the context of that figure, and I think something that's been challenging even since the very beginning of the pandemic is that people don't really realize how uncertain all of these figures that you see are. I mean, a good example that I've always thought of is the reproductive number, right? The R0 or the RT that you hear about in the news, particularly in the UK, because the government, I believe, in the UK has been reporting on that constantly. And people don't realize that it's quite hard to calculate a true reproductive number. Those are estimates based on these complex Bayesian models with lots of different inputs. And when you actually get the output of those models, what you find is that there's a big range. And you see this even in the early papers. The CDC originally estimated that the reproductive number of COVID was between 2.5 and 3.6, I believe. But then they later estimated in April that the original reproductive number might be as high as 6. And so the true range that even now they present on their website is somewhere between 1.3 and 6 in a totally disease naive population. And yet the only thing you ever hear in the media or I mean, I don't want to slam journalists here, but the only thing you ever hear from most people, including scientists, is a single figure, a single number, and that gives us a false impression of certainty when, in fact, we don't know very much or we're very uncertain.
So big picture here then is what you're saying is that it would be nice if not only journalists, but the general public had communicated or learned or were taught in school a better understanding of what the scientific method actually is, what falsifiability is, that science is never a settled and agreed body of fact.
Yes, essentially, but also not even that it's a settled and agreed body of fact, but that even when you do have a settled and agreed body of fact, even when we know with a great deal of certainty that something is true, and let's say the existence of the SARS-CoV-2 virus, we know that is true, that it is a virus that exists, it infects people, but even then there will be uncertainties, and there will be points that some people are not, that scientists are not sure about.
Back to the here and now for a second. The body of commentary right now as to how this pandemic ends is that it becomes endemic and it becomes no more lethal than seasonal flu. A, is that accurate? And B, in terms of the communications, is it a safe message to communicate now?
So I think I actually would really like to hear my fellow panelists' response to this question as well. But I think the great divide, or the great difference here we've got, is the vaccination campaign. There is a great deal of evidence that once immunized, you are less likely to develop severe disease. Even if you do get infected, you are much less likely to go to hospital, you're much less likely to die. And I think with the global vaccination campaign, if everyone could get immunized, we would be, I guess, out of the pandemic, at least. There would still be endemic SARS-CoV-2. There would probably be people getting infected every year, but the risk to those people would be very, very substantially lower than the risks that you see for people who are unvaccinated today. The challenge there, as again, everyone has mentioned, is that we do not have a good global vaccination campaign. Currently, what we see is that rich countries, I live in one, have purchased far greater numbers of vaccine doses than they require. They have started immunizing low-risk groups before sharing vaccines with the world. And as a general rule, what we're seeing is just this kind of hoarding of vaccinations. And so I think we do certainly have a foreseeable future in which the COVID pandemic ends soon, potentially by the end of the year. I don't think that that future is going to be the one that we will experience. I think much more likely is that the pandemic will continue for some time as our vaccination campaigns, kind of slowly roll out to the rest of the world. And there may be infections and very severe infections for years to come. I mean, it's worth noting, for example, that Brazil is still experiencing some of the highest levels of infections and deaths that they have experienced at any point in the pandemic. I believe that the highest day for deaths was only a week or two ago in the country. And when I talk to my colleagues in Brazil, they've either had COVID or they say, well, I'll get COVID eventually because I'm not going to be able to be vaccinated.
All right, thank you very much, Gideon. That's really quite enough questions from me for the course of the last hour and a half. I want to start throwing it open to questions to the audience. Barbara, you've been curating some of those.
Yeah, we have a question from Sean Duke, well-known science journalist here in Ireland. Scientists know that there's very little that is 100% certain, but journalists need them to say something definite in order to have a story. This was particularly true with the COVID story. How can we best resolve this basic tension between what scientists feel they can say and what journalists need them to say?
Carl, do you want to pick that one up first? You did touch on it, but it is what is fundamental to the relationship between scientists and journalists.
It is. I mean, I think that one of the really important things to do there, and it's a very hard thing to do, and I agree with the tension about what journalists need, especially in order to get clicks. But I think what we have to do as scientists is do a good job of contextualizing the uncertainty that we're facing. Say, we don't know these things, here's why. And that includes a lot of, even includes making some sort of subtle distinctions. We don't know this because we haven't done enough science yet versus we don't know this because it's a fundamentally stochastic process. So, if I have one infection that's introduced into the local school, how big is the outbreak going to be? Well, even if I know everything about the disease, I don't know whether we're going to get unlucky and that kid will happen to transmit to other people, or whether we're going to be fortunate and it'll peter out there. So it's that kind of uncertainty. And then there's this sort of epistemic uncertainty where we don't know enough yet about the disease. And so we need to do a much better job at explaining, when we are talking to journalists, at explaining what new findings have revealed, but then contextualizing that in terms of the surrounding uncertainties that we face. Journalists, I would like to see do a better job of being clear with their audiences about what is not known and what is the likely time scale under which these things will be figured out. So that's a very hard thing to do. I understand that level of nuance is not necessarily what a lot of audiences are looking for. It certainly doesn't play well on Twitter or something like that. But fundamentally, if the idea is to inform people so that they can feel the sense of control, we want to make people feel empowered in a world where there are very scary things happening, like a pandemic. And so in order to provide a sense of control, you have to have understanding, and you have to have reasons to have faith in that understanding. And if you have been told that there's very little uncertainty and things have flip-flopped several times, you give up any faith. If you're told, look, we don't know this yet, we're in the process of narrowing this down, this is the range of scenarios that we could be looking at, yes, you don't have that sort of immediate comfort of certainty, but then you sort of build up this confidence in the stream of information that you're receiving. So maybe that's too large of an ask, and but that's what I'd like to see.
Well, let's get the other side of it. Meg, how often do you find yourself saying, oh, look, come on, Professor Bergstrom, can I pin you down? Can I have a little bit more certainty, or at least a little bit more brevity here? Or do you just take it as your job to say, I have to synthesize what this man has said to me and communicate it as comprehensively and concisely as I can?
You know, a little bit of both. I think sometimes it's just a matter of making sure you really understand the point that somebody you're talking with is making. I think sometimes you'll be having a conversation and it'll just kind of seem nebulous. I have this with multiple people. I mean, if you guys know Mike Osterholm at CIDRAP in Minnesota, sometimes when I talk with Dr. Osterholm, I'm like, wait, so you're saying we don't know and we might never know? And he's like, yep. And I'm like, well, what are we supposed to do? And he's like, it's not a good situation. And you just kind of have to, you ask a bunch of questions, make sure you truly understand that he's really saying, we don't know, we might never know. Every time we've thought we knew, we didn't know. And, not everybody.
How the hell do you put that into a headline?
What's that?
How do you put we don't know and we might never know into a headline?
Yeah, it's not great. And luckily on television, I don't have to write headlines too much. And so, what I try to do is to talk with, the best experts I can find and gather as much information from them as I can, and then represent how they portrayed how they're seeing things to me accurately, but in some kind of conglomerate as best I can. And I think on TV, I do get the luxury of being able to say, people aren't sure about this, but, this is what I've learned today about this most recent news. I think it can be different in different media. And sometimes we do try to push for more certainty, but folks like Dr. Osterholm will refuse to give it.
Could I just jump back in with one other comment, which is just another extremely valuable role that media have played, I think, over and over again. The people that are very, very good about this are good. And also, there's another kind of uncertainty where you have a number of scientists, each of whom are individually fairly certain, but they disagree with each other in good faith. And so one of the things that I found, extremely valuable that good journalists always do, and you've referred to this, Meg, is that, paper comes out, you don't just look at the press release or talk to the authors. You then call 3 other experts who are unrelated to the paper and help, again, provide context with that and say, okay, this paper indicates certainty, but we talked to these 2 other people who think that there's a problem with this, and and therefore we think, overall the science is still open. And, I see that over and over again. All the best journalists do this every single time. And this is why we often, as professionals, learn from, we keep up with what's going on from people like, yourself, like Helen Branswell, because we don't have time to get on the phone and call 6 people, and they wouldn't answer our phone calls anyway, but you do. And so then we say, oh, okay, that's that new paper that I just read, but here's 5 comments from other colleagues. And now I've got context, right? So that's a very powerful thing to do.
I have a comment about.
Sorry, Jody, go ahead.
Talking to reporters about uncertainty, and I strongly recommend, and the CDC even put this into their crisis and emergency risk communication guidelines when we worked with them on it after SARS and during H5N1. The idea that you talk directly to the reporter and saying, we wish we could be more certain, we all wish. This is called expressing wishes. And it's, believe it or not, the category called expressing wishes is an official recommendation in the CDC crisis and emergency risk communication guidelines. You tell the reporter, we wish we could, everyone wishes we could. I'm not saying that this is definite. If you need me to say that it's definite, go talk to someone else. I'll try to help you hold on to this uncertainty. So you actually go meta with the reporter, so you get them with you. That the job is to capture your uncertainty and convey that to the public. And it's part of very much humanizing the science. So like Carl said, we know this, we don't know that. So you're describing the degree of uncertainty that you have, but wrap around that description the humanness of how much you wish it was more certain and you hope that it will be soon. Here's what we might know in a couple of weeks. And then say to the reporter, I know you're going to be tempted to synthesize this down to something more definite. You're going to reify this into a statement as opposed to a question. But if you can convey to your audience that what I'm saying is really a question and that I wish I didn't have to be so uncertain, it's that humanness that makes it go down a little bit better. And I also saw one of the questions that was listed about uncertainty in that one of the other participants submitted. I don't know if it's going beyond my mandate to say it, but the person said, doesn't uncertainty lead to more, there's some research that shows that when scientists are uncertain, it leads to more distrust and mistrust by the public of scientists. And I'd like to maybe give that a better nuance, or at least my opinion of a better nuance. When scientists are uncertain, it does lead the public who had previously maybe idealized the scientist or had them on a pedestal to think that that scientist is less competent than the public thought they were. But the public often also thinks that the scientist is more trustworthy, because what they now know is that the scientist is going to tell them, I'm uncertain today, I'm uncertain tomorrow, I'm uncertain the next day, but if I know what I really think on Friday, I'm going to tell you. And then the public knows that when Michael Osterholm says he's certain, you can go to the bank on it.
Very good. Okay, Barbara, next question there.
Just to say that, thanks for that, Jody. That was a question actually from a colleague in DCU, Eileen Culty, in her area is misinformation and disinformation. So we have a question here from Tomas Fay, and he's high praise for you, Philip, for your chairing of the panel and for our panelists as well. But he wants to know, how can we kind of like really ingrain trust amongst the public when it comes to the uptake of the vaccine?
Ooh, okay, that's a big one. Gideon, do you want to take a shot at that?
I don't know if I'm best placed to answer that, but I think, I guess my opinion would be that what we've been saying throughout kind of applies here as well, in that honesty and sticking to what we know and what is uncertain is often the best policy. And I think we've seen that with, say, the AstraZeneca vaccine rollout in many places, that saying this is what we know, this is what we're not sure of, and this is how we can kind of move forward with that, has had the best impact on the public's understanding of the risks and the benefits. And I think that the longest lasting impact as well is honesty in terms of vaccination policy.
Muge, did you want to come in on that?
Yeah, I mean, I think when we look at the vaccination distribution, at least I can talk about the UK, you know, the communities who've already been at high risk of infection and already high risk of hospitalization, those are the, you know, most deprived areas, you know, people working in public facing jobs and those living in, you know, crowded households who have been at risk of COVID are less likely to take up the vaccine. I'm not saying it's because of the, you know, the hesitancy of the vaccination among those communities, but I think we're not doing enough to reach to those communities. So, for example, in Toronto, I saw that they opened up night vaccination buses, which basically approaches people who are working, you know, night shifts. They can't go to vaccination center during the day. So there are certain things that we are still not considering. Especially, I'm worried that, you know, the communities which we've seen high transmission rates will be those who have the low vaccine coverage, and that's where we maybe continue to seeing, you know, small or big outbreaks, especially among those communities where they're working in workplaces like meatpacking plants and, you know, homeless shelters. We've seen those infections and big outbreaks happening. Again, like nursing homes, for example, when we look at some of the outbreak investigations, majority of staff working in nursing homes also live in most deprived areas, also basically are, among much more ethically, minority groups. So the question is, like, I think trust is important, because this trust doesn't really come at the time of pandemic. What governments have been doing before pandemic have affected people's trust, taking up the vaccine or going to an appointment. So those are the main things. And I think for any intervention, even for masks or other things, I think trust comes first than information. And the second thing is, like, we need to have much more network adaptive strategies. Who's at risk most? We need to reach to them most. This is what public health does, and we haven't been doing it enough. Like, opening vaccination center is not going to be enough if not enough people are coming from certain communities. And we're actually seeing that in the UK. Ethically minority groups are basically like, they're taking second vaccine coverage is about 50% versus 85-90% among British citizens. So it's just that disparities are, again, we're seeing both in infection rates, hospitalization rates, and same again for vaccination coverage.
Jody,
I just quickly like to pick up that point, because I think we tend to focus on vaccine hesitancy and vaccine denial because it makes headlines that people are saying, I don't want this vaccine, and refusing it. But there is quite a bit of research demonstrating, and there's some research, particularly in Australia from the University of Sydney and the National Centre for Immunisation Research, showing that actually the biggest reason why people don't get vaccinated has nothing to do with vaccine hesitancy. And as Mugai was saying, it is literally to do with access, ability to get the vaccine. And I mean, in a global context, that is an obvious reality. The main reason why people aren't being vaccinated across the world right now is because they literally physically cannot get a vaccine. And if we could vaccinate everyone who wants a vaccine, I suspect we would be above 90% in most places in the world, even despite the headlines about, these surveys that have implied higher levels of hesitancy.
And that completely takes the wind out of the sails of my supplementary question, because I was wondering, looking at the example of Scotland, where you have a political leader in Nicola Sturgeon who has put herself out front and centre doing daily briefings, and who enjoys a relatively high level of certainly satisfaction ratings. I suppose my question, which I'll ask of you and of Jody, is it risky, do you think, to associate one person, one personality with a public health policy in the way that has ended up happening in Scotland? Or from what you're saying, Gideon, is it all completely irrelevant, and that it's really just about how easily you can access the vaccine?
I'm not saying it's just about that, but I think Jody might have a much more interesting answer to this than I would.
Jody.
I think the more trustworthy and trusted spokespersons from different parts of society, the better. But boy, it's better to have a Nicola Sturgeon or a Jacinda Ardern or a Brett Sutton in Australia than not to have one. If you have a really good one, milk them to death, use those wonderful people, but then get people from all different venues that represent influencers to all different people. But I also think that not just getting the information out, and not just the access is a technical issue that's terribly important. And I've been fascinated by New York City's ability to reach out to churches, reach out to ball games, and really get the vaccine to where the people are. But one of the things I want to harp on as a risk communication person is that one of the most important elements is how you talk to and about the real anti-vaxxers. So much attention is drawn to the people that are the most viciously, nastily anti-vax because they're fun to fight with. So then we box with them, okay? But the people who need attention are the people that are in the broad middle, that are skeptical or that are politically amongst a crowd that don't take vaccines, and I'm also much more worried about this in the third world and the developing world, sorry about that, than Gideon is. I don't think we're going to get anywhere up to 90% voluntary uptake in most places. I wish it every night. The thing that the skeptics in the broad middle need to see is to see us being respectful towards the people that it is hardest to be respectful towards. And that's the real fervent anti-vaxxers. No matter how few of them there actually are, they get so much press, they make themselves so publicly visible, and they tempt us so much to be horrible to them and to say horrible things about them. We call them idiots, we say they're killing people. I mean, maybe not as much as I see because I surveil for this on the social media, but the people you have to really target are the attentives, the people that are watching the discussions between the horrendous anti-vaxxers who are saying horrible, untrue, nasty, vicious things, and the deniers, and the people like us who want everybody to get vaccinated. We have to almost put on a play of treating them with massive respect so that the skeptics are drawn more to us than to the other side. So when we say that trust comes first, I think that part of trust is that respect from us has to come first. And that's one of my major messages to officials who are trying to talk to or about anti-vaxxers.
Meg, has anti-vaccination become a new front in the culture wars now? Or are we really just reporting on the views of a vanishingly small minority and giving them a platform that it doesn't really deserve?
Yeah, I think there was a report from, oh, I'm sorry, Jody.
No, I'm sorry. No, go ahead.
If you have thoughts, I'm sure they're smarter than mine, but I was going to mention that I think it's the Center for Countering Digital Hate did a report a few months ago calling, a certain number of people driving most of the anti-vaccine content, the disinformation dozen, I think. And they found, it really was this small group of people that had an outsized influence. There's other disinformation, though. I get it a lot. It just seems borderline. I mean, there's a opinion piece in the Wall Street Journal today. I don't know if anybody saw it, but it's in the paper. It's huge. And it just kind of draws a lot of, doubt or questions about how safe the COVID vaccines really are. And I had a colleague send it to me, and it seems like it's from legitimate sources, and there's people with MDs asking real questions and citing real information. And so there are different tiers of doubt inspiring people out there. And Jody, I thought that was such an interesting thing to say, that you should be polite. I mean, it's just a nice thing to do in general, but it's something that I actually noticed when I did a story on the disinformation dozen. I reached out to a lot of them, including, Robert F. Kennedy Jr. and a number of other ones on this list. And they were so polite to me. They seemed very grateful, and I reached out for comment. It was just very civil. And I honestly was worried that, now they have my phone number and my email address, and what are they going to do? And they didn't do anything. They were just, and so I treated them with respect. They treated me with respect, but I surrounded anything that they said with, as much fact as I could.
Jody?
You just got a lovely approach. I don't know what the numbers are of the anti-vaxxers. There's lots of data on it. There's silent anti-vaxxers, there's loud anti-vaxxers. I certainly know that in the United States, when the rumors went around that there was a huge anti-vaxxer population and it was causing measles vaccination to drop, and the expression went, measles is roaring back in the United States, that was false. Measles vaccination rate stayed very high, except in a few pockets. Very little measles came in. Measles was eliminated. It remains eliminated. It's not endemic in the United States. It never roared back. So the fact that these few people with very loud voices have a lot of influence, and they draw a lot of our attention, and they also make us so angry that we sometimes act out. And I mean, the acting out against anti-vaxxers on social media by named scientists caused me to start a category that I call pandemic grown-ups. And my list of pandemic grown-ups is officials and experts who communicate without being disrespectful of the people who are yelling at them. So the pandemic grown-ups include Jeff Duchin from Seattle King County. They count Ben Cowling from Hong Kong, who gets lots of attacks on, you know, his opinions and his viewpoints. And you could go on my Twitter and find my pandemic grown-ups. But it's like people who have managed to be respectful and kind to the people that have to be making them crazy. And we should all kind of aspire to being pandemic grown-up communicators. And in my private life, I can be as snarky as everyone else. But if I ever catch myself doing it online, or if my husband catches me saying something, I'm going to delete it as fast as I can.
Could I add a point, actually? Like one of the things that we've been discussing as part of WHO infodemic group was actually putting science communication as part of pandemic planning. You know, that has to be part of it. And I mean, in terms of anti-vaccine, yes, I'm worried. I think in the UK, we don't have a big problem at the moment, but I'm much more worried about actually misleading content about vaccines, actually coming from, you know, some experts like Twitter experts and some celebrity experts. I think someone was asking about that. For example, when Delta variant came up in the UK, there were lots of people saying that vaccines are basically resistant to this Delta variant. And lots of people I've seen in the clinic, they were so hesitant to take the second vaccine because they were thinking that, oh, okay, this is not working anyway. Why I'm going to put myself at risk just taking the second dose? Actually, it turned out that it was pretty good. First dose is really good, over 90% protection against hospitalization, and 2 doses are pretty good, even, you know, preventing infection. So I think, you know, I'm much more worried about, you know, some people who basically achieved a certain level of network online, but they're just sharing misleading content because they don't actually have the background knowledge to weigh up the information and data available in terms of vaccines. I mean, at the moment, what I'm saying is for any vaccine, for any variant, vaccines work pretty well, you know, and it's basically works unless proven otherwise. That, you know, that should be the, you know, message, because that what's been happening. But, you know, lots of hesitancy is also coming from all these, you know, confusing and misleading content.
Okay. Muge, thank you very much. Thank you also, Carl, Jody, Gideon, and Meg. I'm going to hand back to Barbara now, hopefully on time, and report happily, just before I do hand back to Barbara, that the 2 paracetamol have worked, or maybe my wife's diagnosis was right, and that I'm over the worst the symptoms of vaccine number 2, or jab number 2. Thank you all very much for a very pandemic grown-up conversation. I certainly enjoyed it and learned a whole heap from it, and I hope everybody else watching it did. Barbara.
Thanks, Philip. But just to say many thanks to our panelists this evening for a really informative discussion, and yourself for your excellent chairing of that discussion. I will hand over now to the Director of the Celsius Research Group at Dublin City University and Chair of the Master's Course in Science and Health Communication, Pádraig Murphy, for summation. Thank you.
Thank you, Barbara. And my job in the next 5 or less minutes is a communication challenge in itself, because I have to try and condense all the wonderful ideas and suggestions that were there into that short space of time. But we did set up this event to look at trials, challenges, and lessons. And I think we heard all of those here today. In terms of trials, I mean, science itself, of course, as Jody, Carl, Muge, and Gideon said, we've never seen so much intensity of science. It actually, to produce the vaccine, to produce the Johns Hopkins indicator, ways that we were able to see how science in action. And the thing is, of course, that politics itself was on trial as well, and certain governments around the world probably didn't step up to the mark here, and this has been the real issue. The issue of trust. This came up so much in so many of your talks, that, you know, the idea that the publics can't handle this, and of course we know they can. Everything that you've said, all of you have said here today and this evening, has been showing that they can handle uncertainty. And what it needs, the best cases of these trials, I suppose, were where openness and honesty were shown by governments. And this is definitely, as we go into the lessons, one of the things we can look at here. But other challenges, of course, is the complexity of the data. We talked about preprints and you know, peer reviewed probably didn't step up to the mark. And of course, there's a huge amount of data. But as Muge said, the data will also have a message, and finding that message becomes hugely important. Good science will actually produce good communication. And that is something then that is a challenge, of course, for journalists and for other science communicators to be able to sift through this and to be able to look at this. Other challenges here, of course, were on the disinformation, which is obviously there, and the colorful and very accurate phrase or term that Carl uses of bullshit is still there. And in actual fact, it's there in quite a lot of intensity. But that trust issue has to come back. I mean, there is definitely a fight to be fought against disinformation, but we still need to trust people and trust the communicators to be able to point to the right sources, as it were. The inclusivity, I'm so glad, I'm sorry for my bias here, but what Gideon had said and Meg and Muga said at the end as well about the inclusivity, those people that don't actually have access, this becomes a big issue as well. And we need to make sure. Muga said that we now know, I mean, we're not out of the water here. This is a longitudinal study in itself. So we can see exactly what we did right and wrong, as Jody already pointed out in the beginning. And actually what Jody said as well about the openness, it also comes to scientists, the scientific disputes. They are important because, of course, we were learning as we went along, and we should trust that. The humanness of scientists, as Jody said, but actually the access to the vaccine, but also the information becomes hugely important in this. Up to this, be able to know exactly what to say at the right time. And so I think that idea of more news desks and more science news desks becomes really important. I will finish now with a list of thank yous. I know Barbara and Philip have already said it, but there's quite a few people we need to thank here. The Office of the President for their support, of course, President of DCU and the DCU President, Dara Keogh himself, our wonderful speakers, of course, Jody Leonard, Muga Cevic, Carl Bergson, Meg Tyrrell, and Gideon Marowitz-Katz. And Philip Bush or Hayes, you certainly don't look like you had your second vaccination today, because you did a brilliant job pulling all this together. We need to also thank Carvin Doherty, who handled tech support really brilliantly here. Caroline Cullen, who you don't see here, but who has worked tirelessly behind the scenes to make sure there was a smooth running of this event, and Sinead in the faculty office as well. But a very, very, very special thank you to Barbara Gormley, my colleague here in the School of Communications, who conceived and organized this event. She has been the person that's been getting you all involved in this, and without her, this would not have happened at all. But also to our audience, thank you very much wherever you are in the world, as it were, and for being so attentive but also active. Some brilliant questions came through that made us consider some of the reflections here as well. I don't know, we're not out of the waters yet. Maybe the W.B. Yeats line of the clouds were brightening with the dawn hopefully will happen soon. But I want to close this event to wish you all a very good evening or morning or afternoon. And thank you very much indeed for staying with us with this. Stay safe and stay well. Thank you very much indeed.